Hi, I'm Ed Jacobs, founder of Impact Therapy, and I'm here with Heidi O'Toole, who is currently a visiting professor, visiting instructor at WVU. And what we're going to do is talk about impact therapy, which is an active, creative, multisensory, theory-driven approach to counseling. But we're going to tie it in with addictions. Some of you maybe have seen the other impact therapy YouTube clips. But Heidi is an expert in addictions counseling. So Heidi, why does impact therapy, why did you tie these two together?
Well, just what you said, multisensory. To be multisensory is, to coin your phrase, the brain loves novelty. And so when we're dealing with people who've been addicted, obviously there's been major side effects in the brain. And so it's important to engage. It's very difficult to engage people who have been tuned out or have been anesthetized for several years. So when we use a multisensory approach, we engage this population.
What do you mean by multisensory with the addictions? Show us some of the things.
Well, some of the standards that we use, obviously, is the whiteboard.
Let me say something. The whiteboard is probably the single.
Absolutely.
I mean, that's our number one thing
Absolutely.
of making counseling more visual.
Yes.
That's true with anything. But
And
go ahead.
So we use the whiteboard to engage the visual component. And then we use what's familiar to the brain, so engage to retain. So I often use an empty beer box and or a can, just to show the different stages of use and abuse and addiction. I also use the little chair, which is a staple in impact therapy.
Hold up that little
We
chair,
use the
please.
little chair in conjunction with the box. This is who you are. This is what you've become, just to show how the addiction just interacts with our personhood. I use a shovel very often. The addiction is digging the hole deeper.
And a lot of people think that impact therapy, that looks cute, but there's nothing.
No, it's not cute. It's not a trick. It's not a,
Because that's exactly what happens.
You dig the hole deeper. One of the sentences I use is, "We've got to get you to put the shovel down."
Yeah, I just had a young guy talking to me, 26-year-old fella, and he hadn't lost his job. I said, "You will if you keep doing this," and sure enough, I heard he lost his job.
And he lost his job. And that's the progression. Certainly that's the progression. I also, again, to engage to retain. If I can engage the brain, there's a better shot of retaining. And when we're multisensory, we're trying to use as many senses as possible to focus the client. And once we have the client focused, we can go deeper and funnel, following your approach.
Yeah, we will be talking some more. We're going to make probably 5 or 6 more clips on impact therapy and addictions. And if you want more information about impact therapy, go to the website impacttherapy.com, or we have a new book out, Impact Therapy, The Courage to Counsel.